Yes, they did have a very tough lockdown, but they also didn't support the working class, for want of a better word, to basically go through the lockdown in a way that would have a minimal impact on their personal livelihoods. The working force of India was effectively hit very, very hard because, if you remember, there were thousands, hundreds of thousands of people stranded across the country, away from home, away from a residence of any sort, trying to get onto the trains and get back to where they originated from. Many of them didn't have enough money to support themselves, even their daily bread. So it's not surprising that after that debacle, if you like, and the current and ongoing problems around the provision of healthcare in India, we're going to see continued transmission and continued death and suffering in this country.
What do you make of the mortality rate? Because the figures from Johns Hopkins suggest a mortality rate of 5.22 per 100,000 of population in India, and that compares with, for example, the US on 57.63 or Spain on 62.96. What do you make of the relatively low mortality rate compared with infection rates?
Well, the answer to that question is in your last report, in that most people don't have access to or even get recorded for the correct cause of death in India because they don't have access to healthcare. And if you don't get diagnosed appropriately, what is there to say out there that the rural parts of India are reporting correctly the mortality rate?
And it's not, so it couldn't be down to the fact that it's a younger population?
Well, one could put that on one hand, and on the other hand, they could say, lack of nourishment is quite widespread in India. Generally, ill health is quite widespread. Even in the more affluent parts of the country, we have a lot of diabetes and heart disease, so there's an increase of risk there. But there are far too many factors at play here, but what we definitely know is that there is an underreporting, and that underreporting is unfortunate, but it is what it is.
And so is that your view of what's happening in Mexico? Do you think they're similarly underreporting the deaths from COVID-19?
Mexico is a slightly different story. We have issues there, or alleged issues around obesity and diabetes. But we also know that per capita, they have only 2% of the amount of testing that is being carried out in the United States at the moment. And the problem there also has to do with reporting and access to healthcare. And even when people get to healthcare, it's the quality of the healthcare that they receive that is not necessarily good enough.
Tell me about Europe. The reports there that are suggesting that it's more younger people who are now being infected, and as a result, the death rates are staying relatively stable, and the hospitalisation rates as well. What do you think accounts for that kind of switch, if you like, to a younger caseload?
Well, I think the interpretation of this data is that a lot of the younger people are expressing the fatigue that we were warned about at the beginning of the outbreak. That if we entered a lockdown too early, or if we suppressed transmission through physical and social barriers, people would basically get fed up, and they would take off their masks and they would hug their friends and they would interact with each other and throw caution to the wind. It appears that mostly the young are the ones that have been doing so, and as a result of that, the virus is now transmitting very effectively throughout the younger European population, which is quite scary if one takes into account that universities are about to open, and we've got thousands of children that are going to be, or people's children that will be moving across the continent, entering universities, and the mixing environment there that could be quite a problem.
Stelios Moskos, thank you very much indeed for talking to us. Thank you.